Welcome to Dharya Veda. The today's topic is the drug we have chosen is ashwagandha. Let us study what is ashwagandha, how it acts over our body, what are the properties of ashwagandha, and what are the recent researches and the utility of or application of ashwagandha in treatment aspect. So let's start it. Firstly, basonym. What is the basonym of ashwagandha? Ashvasyeva gandho asyaha अथवा अश्वस्येव गंध उत्साहः कामवेगाः यस्य सेवनेन सा. So what is the basonym? Ashvasyeva gandho asyaha, the one which is having the smell like that of the horse urine. The root of the ashwagandha, when we pluck it out, uprooted, then the root will have that smell of a urine of a ashwa. So it is called a ashwagandha. Athava or अश्वस्येव गंध उत्साहः कामवेगाः यस्य सेवनेन सा. By consuming the root of ashwagandha, one will have the sexual desire or one will have the sexual power as like that of the horse, and it imparts the sexual power to the man. This is the basonym. And next comes botanical name. What is the botanical name of ashwagandha? Vitania somnifera. What is Vitania somnifera? Vitan is the one who the scientist, name of the scientist, and somnifera is the one which induces the sleep. Somniferous drugs are the one which induces the sleep. So this ashwagandha is the one which induces the sleep. So we usually prescribe for the patient who complaining of pain and the sleeplessness, insomnia and condition. This is a very has a very good effect. Then it belongs to the family Solanaceae. Vernacular names, that is regional names, are in Kannada we call it as a Hiremadina Beru. In Kannada we have one saying that Gottillada Vyadige Hiremadina Beru. The means the disease which is unknown, then we have to prescribe a ashwagandha, that is Hiremadina Beru, which will act in a multi-dimensional way and cures any kind of diseases. And in Hindi it is called as a asagandh, and in English it is called as a winter cherry. Why it is called as in winter cherry? Because it has a small reddish color fruit which looks like a cherry only. That's why it is called as a winter cherry. The next Mahakashayas under which it is mentioned are, according to Charaka, Balya Mahakashaya and Brahmaniya Mahakashaya. In these both Mahakashaya, the ashwagandha has been mentioned. Then next comes synonyms. What are the synonyms and why it is called by such synonyms are, first one, based on leaves, it is called as Gandhapatri, Varahakarni and Varahaparni. So why it is called as Gandhapatri? Gandhapatri means Patranam apya ashwagandhitvat. As previously I have said that the root, when it is uprooted, when it is plucked out, will have the smell like that of a horse urine. Also the author is saying that the patra, even the leaf, will have the smell like that of a horse, which is not true, or we don't know. At that olden days it may had that smell, but nowadays we are not finding the smell like that. Then next one, Varahakarni. Varaha is nothing but the pig. So it is called Varahakarnavat Patrana Asyaha. The leaves resembles the ear of the pig. That is why it is called as a Varahakarni. Then Varahaparni. Why it is called as Varahaparni? The same reason, Varahakarnatvat Patranya Asyaha. So the leaves of the ashwagandha resembles the ear of a pig. That's why it is called as a Varahaparni. And based on the roots, it called as a Ashwakanda. Why it is called as Ashwakanda? Ashwasya Gandha Yuktaha Ashwasya Atha Kama Shakti Pradaha Kandaha Moolam Asyaha. Why it is called as the Ashwakanda? This root, when uprooted, will have the smell like that of a horse urine. That's why it is called as ashwagandha. Also the root on the useful part is kanda, nothing but the root of ashwagandha, what we will give in a churna form, or churna, we will use it in a form of churna or avaleha, anything. So that formulation of ashwagandha will impart the sexual power or the vigorousness or virility to the man or a woman like that of a horse. That's why it is called as a ashwagandha. Then based on action and property, we have synonyms like Ashwavarohaka, Kanchuka, Kamarupini, Prutrada, Balada and Marutagni. Why it is called as a Ashwavarohaka? Ashwavarohaka because Ashvam avarohayati adaha karoti pumstva shaktau iti. This pumstva shakti, that is imparts the sexual power as like that of the horse. That's why it is called as Ashwavarohaka. Avarohaka is nothing but the excitement or good feeling and excitement, feeling of excitement. This imparts the sexual power as like that of the Ashwa. That's why it is called as Ashwavarohaka. Then comes Kanchuka. Kanchate bhannati shukram deepta karancha, which increases the time of a libido, the time of a some people will complain about a premature ejaculation where they can't retain their semen for a longer duration, and this is the one of the leading cause for infertility. Also the lack of a satisfaction in the during the sexual act, and this leads to the mental disturbance and leads to the anxiety, stress and depression, so called mental problems. So Kanchuka is the one which helps to retain or increase the retaining power of the erection. That's why it is called as a Kanchuka. Then comes the Kamarupini. Why it is called Kamarupini? Kamasyeva Rupam Bhavatyataha. This gives the desired effect to the body. Either it may be in a not only just a physical like a sexual act, also for the beauty, also for the strength, also for the muscle bulk. It helps for overall development, whether it may be a psychological or a somatic. It helps to increase and vitalize the body. That's why it is called as a Kamarupini, one which gives the desired effect for the body in any means. Then Putrada. Why it is called Putrada? Putram dadati shukravardhakatvat. Because it is, why it is called as a Putrada is because as we prescribe this medicine when a person is having the premature ejaculation or any problems related to the sexual act or infertility, and this increases, helps to enhance the amount of a sperm in the semen, and the motility of increases the motility of a sperm in the semen and helps in the erection problems and all sexual related problems. Also the psychological enhances the psychological health, where the in the act of a coitus or in kind of a reproductive health, there is always a psychological health status play a vital role. It gives the pleasantness, or it helps for the recovery of any kind of a depression and anxiety and all by giving the strength to the body. That's why it helps to get the virility, and by that the men or women will men is capacitated to have the baby or the have the children's. That's why it is called as a Putrada, by one which a person can have the offsprings. That's why it is called as a Putrada. Next comes Balada. Why it is called as Balada? Balam dadati balavardhanityartaha. It imparts the strength to the body. That's why it is called as a Balada. Marutagni. Marutam vatavikaram hanti. The Ashwagandha acts over the vata, which is the main reason for any kind of a diseases, and enhances the capacity or ability of a vata to function in a proper manner, and imparts the strength to the body by increasing the any physical and psychological health. That's why it is called as a Marutagni, and it controls over the Vata disorders. And Vrusha, also it is called Vrusha. Why it is called Vrusha? Because increases the sexual potency. That's why it is called as the Vrusha. These are the synonyms of Ashwagandha and why they are called so. Then comes habitat, where and all we can find out the Ashwagandha. Throughout the drier parts of India, we can find this Ashwagandha as it grows easily. Then morphology, how it looks like and how we can identify it is as a Ashwagandha. Let's see now. Swarupa, Romashagulma. It has a minute hairy like structures over the stem, leaf and all. So it is a Romashagulma. And stem aerial, erect and cylindrical in shape. Leaf are quilline and ramal type of leaves, and simple and alternate arrangement will be there. And inflorescence, axillary umbellate inflorescence. Fruit is we already seen in English name, that is regional name, a winter cherry. So it has the small and berry, small fruit, like a type of fruit is berry and the color is red color. So we call it as a winter cherry. It's a small kind of a cherry. Then main is a useful part is root. So let us study the in detail about the morphology of a root. So how the root is there? How the root is there? It is in the shape of cylindrical. How? 5 to 8 mm diameter. Whereas this is the cultivated ashwagandha, whereas in a wild ashwagandha is not ideally a cylindrical one, but it has a cylindrical shape, but it's not ideal cylindrical. It will have many zigzags and all, and will have one centimeter of diameter will also be there, and outer surface is light brown, finely wrinkled longitudinal furrows will be there. Then odor is slightly pungent, and taste bitter and acrid taste will be there, that is tikta and kashaya rasa will be there. Next comes phytochemicals, which is the most important constituents of the ashwagandha, which are helping nowadays like a very wide spectrum. Those are somniferine, somniferenine, vitanine, nicotine, pyrazole alkaloid, that is vitaniol, and vitaniosomnine, tropine, vitanolide, anaferrin starch, beta sitosterol, and so all many of the constituents are there. So firstly we will see that somniferin is the one which induces the sleep, helps to induce the sleep. By this constituent we can administer it in a many kind of insomnia or psychological disorders. And next comes the steroidal content, that is vitaniol, which helps for a subsidation of a pain. As we said, vata marutagni, that's a synonym it has, one which controls over the vata, one which subsides the vitiated vata. So the main symptom of a vata is nothing but the shula. Whenever the vata is involvement in the pathology, there will be a intolerable severe kind of a pain will be there. So the vitaniol is the one steroidal content which helps us to decrease the pain, and by which it acts as a vatahara. And many are there. The nicotine, the one which acts as a anti-acne, we can give it in a acne vulgaris and all. So in many of the large spectrum of a disease, we can administer based on the phytochemical constituent. We see it in a upcoming movement. Then next comes the Rasa Panchaka. What and all the Rasa Panchaka are there in Ashwagandha? Rasa is Tikta Kashaya Rasa, Guna, the special Guna like Lagu, but it is Snigdha, having the Snigdha Guna. Vipaka is Madhura Vipaka, whereas Virya is Ushna Virya. Doshagnata is Kafavata Hara. And next comes action and indication, that is Rogagnata and Karma and Rogagnata. What is the action? Vrishya, that one which imparts the potency. And so it indicated in infertility condition as a Vajikarana. Balya, one which provides the strength to the body. So we can indicate in a Shosha, Karsha, Daurbalya, anemia, any kind of a weakness or emaciation in the body, we can give it. Rasayana, Krusha person, not only Krusha, anyone can take this, a healthy person in order to keep his health or her health, or a deceased person to get rid of his or her disease. Then Shukrala, mainly it increases the count of a sperm, increases the quality of a semen, so and increases the time of a libido. So we can indicate it in a premature ejaculation or erectile dysfunction, we can administer the ashwagandha in any of the forms. Then Shwasahara. So the kshara of ashwagandha is administered with a madhu as an anupana to cure the shwasa in very good way or effective way. And next comes Amayika Prayoga. How and all we are taking this, administering the ashwagandha, and in what and all the condition. So firstly, as a rasayana and vajikarana and for a shosha, ashwagandha with kshira. So usually every doctor will prescribe this. Like how to take this? Like one glass of milk in the early morning, and in the night we need to add one tablespoon of ashwagandha churna and mix it. It will be like a tikta kashaya rasa, something like a bitter acrid taste will be there. So that we can add some more sugar for that, which we can make it as a palatable. Then we administer or advise the patient to drink the ashwagandha with the kshira for 3 months, 4 months, or 15 days, or else we continually advised to take it. That helps for shosha. If the person is krusha, if he wants the muscle bulk or opacity of his body, the good stature, and rasayanartha or vajikaranartha, in case of a infertility or reproductive health problems, we can administer it. It has a very good effect. And insomnia, and many of the my patients, as I have tried ashwagandha with kshira, as I'll usually prescribe with sharkara, or we can also give a grita. One who hates the kshira, usually some people will lactose intolerance, or some people will have a aversion towards the milk. For the such patients, we can give a grita, or else we just can administer with the hot water, little bit of a lukewarm water. We advise to take the ashwagandha, which has a very good effect when it comes to the insomnia. When the person usually start to take the ashwagandha with the kshira, or maybe kshira is, when it comes to the insomnia, we need to prescribe it with the kshira, that to a mahisha kshira, the buffalo's milk, which usually buffalo's milk is also one which imparts the sleep, and ashwagandha is also one which imparts the sleep. So the action will be doubled, and the effectivity of our drug is going to be very easy and very in a good amount, good manner. So what should we do? We need to prescribe same kind of prescription. The 2 tablespoon, 1 tablespoon in the morning, 1 tablespoon in the night with the kshira. That too particularly mahisha kshira need to be taken by the patient. What will happen? It imparts the sleep, good sleep in a disturbed sleep, insomnia condition, lack of sleep due to stress, anxiety, and all. The by intake of these medicine within a 5 days, a person feels the difference in his sleep pattern. He feel relaxed, he you feel the proper sleep and all. That much effectivity of a what's this ashwagandha is there. Then next comes garbhadharanartha. As the men in nowadays, due to the male virility is going to is decreasing, and much of the infertility cases are also increasing in manner. So what should man should have to do when mainly complaining of erectile dysfunction, and the stress, anxiety will be the history in that, and the tension nowadays what the this modern lifestyle have, and the improper dietic habits and the habitats what we are following is leading to the reproductive health problem. So what the as a doctor we need to prescribe just as kshira is the one which increases the shukra dhatu, as both shukra dhatu having the gunatah samanyata with samanya gunatah vriddhi, or gunatah samanyata with the shukra. So the we need to apply here samanya siddhanta, which increases gunatah. Now we are treating with guna samanya, when the similar guna dravya will increases the similar quality in the body. So ashwagandha churna or ashwagandha lehya we need to administer in the patient who is complaining of a reproductive health problem, so that they will be relieved. Either it may be a psychological, or it may be any physical deformity like a lack of strength, lack of exhaustion. If the person is feeling exhausted, then we can administer this ashwagandha minimum for 15 to 1 month, then they will see the absolute results. Then comes in nidranasha, as I already told. In when it comes to the cosmetological effect, which I usually focus in a patient, cosmetological usually the cosmetic problems, the patients which are having the cosmetic problems in our face, hairs and all, they usually very desperate of their condition, because everyone wants the beauty and the exact wow like look for everyone, for themselves. So what should we do? We need to do, if it is not of a kaphaja origin, the kaphaja origin, but then we can select the kshira, or also usually we can select this kshira, or we can administer with the grita, or we can administer with the what's that lukewarm water to take the ashwagandha, or simply ashwagandha lehya or ashwagandha taila will be there. We can administer for that for the patients. Then comes a then comes shosha or shwasa, that is breathing problem, or dyspnea, or rajaikshma, that is tuberculosis. What the any kind of a respiratory irritations or respiratory problems, either it may be a cough, or either it may be a breathlessness, dyspnea, asthma, or a tuberculosis. The Ashwagandha has a very good effect. Either we can administer Ashwagandha lehya or the kshara prepared by the Ashwagandha with the madhu we can administer for the patient. That has the very good result. So what is the dose? We need to give in very different kinds we have already studied. So how much quantity we need to administer? We always have to choose the Ashwagandha based upon the person, based upon the condition. The Roga and Rogi, both strength we need to consider, and we need to administer or fix the dose for that particular patient or a condition. What happens is, why it is important, as the Ashwagandha is a very good acting and a very potent drug. So if we administer in a larger quantity for because we will have that when we intake a much more, we will have the much more effect. That's not like that. It has a very high potency. When we administer in a larger quantity more than the own strength of that person, it will cause a loose motion, and further it decreases the strength of a patient. So normally the dose will be churna 3 to 5 gram, which is difficult to intake by the patient in a single dose. What we need to do, TID or a BD, we need to divide the dose, or we need to 4 times 5 times we can give it, half tablespoon, 1 tablespoon with kshira or a grita or milk, as liked by the patient. We can administer with the anupana, but the best anupana is I prescribe is kshira. And when it comes to the lehya and grita and formulation, we need to give a 1 tablespoon either in the morning or in the night or in the both time, based on the condition or a severity of a condition. This is the matra of the Ashwagandha. And Vishishta Yoga, what and all the formulations we will get for the prescription, to write the prescription. Ashwagandha Adya Grita for the Vata Vyadhi or Vrishakarma. If a patient is complaining about the any kind of infertility or in reproductive health problems, or Vata Vyadhis, the Shula or Stambha in the body, unable to move, or a joint problem, insomnia, and stress, anxiety, depression, lack of interest in the work, lack of strength in the body, lack of the excitement in the day-to-day activity, if the feeling of a laziness, then we can administer Ashwagandha Adhyagruta. Ashwagandhadi Quata, especially for a respiratory disorder, we will prescribe this Quata. And Ashwagandha Arishta, in case of a Vata Vyadhi, nothing but Arishtas are a fast acting one. So Mucha, Apasmara, where the Vata is stagnant in nature, Vata Chala Guna we need to give. So we have to give a Tikshna Guna Yukta Dravyas there, and we also give Vata Balya or Nadi Balya Dravyas, that is the Ashwagandha. And we need to combine it with the Tikshnoshna Dravya. So Ashwagandha Arishta is the best choice there. And Ashwagandha Taila, we can give it for a external application for a Balyartha in kind of a Karsha, Rakta Pitta, Vata Vyadhi. What it happens is, Vata is aggravated in the skin also, skin level, Brajaka Pitta, or with the help, with the combining with the Brajaka Pitta and Vata. So Sparshana is the one which occur with the Vayu Mahabhuta. So what when the Vata is aggravated, the Rukshata or the Sputhata of a Twacha will occur. At that time, Ashwagandha Taila we need to give for the massage, then it will imparts the Snigdhata and subsides the Vata, and we can administer it in a Vata Vyadhi Karsha, for Balyartha, Mamsa Balya, and Ashwagandhadi Churna. We can give like a Pandu, Kasha, any kind of emaciation in the body we can give. And we have one taila, that is Bala Ashwagandha taila, Ashwagandha Bala Lakshadi taila. What usually cosmetological effect nowadays, people are suffering from lack of a growth in the breast and lack of a growth in the muscle in the body, muscle opacity in the body is lacking. So what should we do? We need to administer Ashwagandha with Shatavari. Half tablespoon of Ashwagandha, half tablespoon of Shatavari come together. We need to mix them in a milk. Specifically, we need to choose a milk here. Only for those who is averted towards the milk, we can choose the hot water. Then we need to mix them and advise the patient to intake the Shatavari and Ashwagandha. And Ashwagandha Bala Lakshadi Taila, we need to tell the patient for massage over the breast for a breast enlargement, or a massage over a body if the muscle opacity is lacking, if the person is want to have the high muscular body. So then we need to administer for the patient to massage minimum for 5 minutes. in a course of 2 to 3 months, the person or a patient will see the visible result. The patient will see the visible changes in their body or muscular growth.